Hello, everyone. Thank you for joining us for this month's webinar. Our topic is flu prevention, and our presenter is Stephanie Waldrop, and she is an RN and a health coach with Orthus Health. Stephanie?
Hi, I'm Stephanie. Thank you for joining me today. Here are the topics I will be discussing today. What is the flu? What are the signs and symptoms? How is the flu diagnosed? Who is at risk for the flu? How the flu is spread, the types of vaccinations, and common misconceptions. Influenza the flu is a contagious respiratory illness caused by influenza viruses. It can cause mild to severe illness. Serious outcomes of flu infection can result in hospitalization and even death. Colds are generally less severe and do not come on as suddenly as the flu, and they will usually go away on their own after about a week. Some of the signs and symptoms. People who are sick with the flu often feel some or all of these symptoms: fever, chills, cough, sore throat, runny or stuffy nose, muscle and body aches, along with headaches and fatigue. If you are sick with flu-like symptoms, the CDC recommends you stay at home for at least 24 hours after your fever is gone. If you are experiencing some of these symptoms, please go see your doctor. They can confirm if you may have the flu. To diagnose the flu, medical personnel will swab the inside of your nose and back of your throat with a device that looks like a cotton swab. This is called the Rapid Influenza Diagnostic Test, and it will give healthcare providers results within about 30 minutes. If you decide to stay home and just want to do some home treatment, some of the things that you should do are rest, drink plenty of fluids, gargle with warm salt water, use a humidifier or cool mist vaporizer for sore throats and sinus congestion, and cut back on smoking as well. Theraflu and NSAIDs can ease a variety of symptoms. If diagnosed with the flu, your doctor may prescribe antiviral medications, which can lessen symptoms and shorten the time that you are sick by about 1 to 2 days. They can also prevent serious flu complications like the pneumonia. People at high risk of developing flu-related complications are children younger than 5, especially the younger ones even under 2, adults 65 and older, pregnant women, residents of long-term care facilities, people with chronic medical conditions such as asthma, chronic lung disease, heart disease, diabetes, HIV, and cancer, all because they have a weakened immune system. The flu spreads person to person, mainly by droplets made when they cough, sneeze, or talk, and when a person touches a surface or object that has the flu virus on it, and then they touch their own mouth, nose, or eyes. To prevent the spreading of the flu virus, wash your hands often with soap and water, or use an alcohol-based hand rub if soap is not available. And try to avoid close contact with sick people. Cover your nose and mouth with a tissue when you cough or sneeze, and clean and disinfect surfaces and objects that may be contaminated with germs like the flu. The CDC recommends use of any licensed age-appropriate flu vaccine, including inactivated influenza vaccines, recombinant influenza vaccines, and live influenza virus vaccines during this season of 2018 and 2019 flu season. The nasal spray flu vaccine is again an option for vaccination during this 2018 and 19 season. If you do get the vaccine, what are some of the side effects that could occur? You may experience some soreness, redness, or swelling where the shot was given, possibly a low-grade fever, some mild aches, and the intradermal flu shot may cause other additional mild side effects, including toughness and itching where the shot was given. When these problems occur, they will begin soon after the shot and usually last only about 1 to 2 days. Is there anyone who shouldn't have the vaccination? Almost everybody can have the vaccine, but you should not be vaccinated if you've ever had a serious allergy to the vaccine or any of its ingredients. Speak with your professional healthcare provider or pharmacist to see if you're eligible to receive the flu vaccine. You should get a flu vaccine before flu begins spreading in your community. It takes about 2 weeks after vaccination for antibodies that protect against the flu to develop in your body. CDC recommends that people get a flu vaccine by the end of October. Getting vaccinated later, however, can still be beneficial, and vaccination should continue to be offered throughout the flu season, even into January or later. So if you haven't gotten it, maybe in October, if you want to wait and you get it in December, January, it should still be beneficial, but the best thing to do would be get it as early as you can. And also remember that you do need it every year. So don't assume you're protected because you had the vaccine last year. Some common misconceptions. I know a lot of people always have these questions, and this is actually very good information. Can the flu shot give me the flu? No, flu shot cannot give you the flu. Flu vaccines that are administered with a needle are currently made in 2 ways. The vaccine is made either with a flu vaccine viruses that have been, quote, inactivated and are therefore not infectious, or with no flu vaccine viruses at all. Flu vaccination has important benefits. It can reduce flu illnesses, doctor's visits, and missed work and school due to the flu, as well as prevent flu-related hospitalizations. The flu vaccine also has been shown to be life-saving in children. Flu vaccines help protect against the main types of flu viruses circulating. Typically, someone with a mild illness can be given a flu shot, but if it is a moderate or severe illness, vaccination is postponed until the person recovers. A mild illness is not a contradiction to getting the flu shot, and delaying it can potentially result in a missed opportunity for vaccination and related protection against the flu. Unfortunately, some people can get infected with the influenza virus despite getting vaccinated. Protection provided by influenza vaccination can vary widely, based in part on health and age factors of the person getting vaccinated. So in general, the flu vaccine works best among young, healthy adults and older children. Some older people and people with certain chronic illnesses may develop less immunity after vaccination. And if you have an egg allergy, here's some special considerations regarding that. The recommendations for vaccination of people with egg allergies have not changed since the 2016-2017 flu season. So people with egg allergies can receive any licensed, recommended, age-appropriate influenza vaccine and no longer have to be monitored for 30 minutes after receiving the vaccine. Thank you for listening to the flu prevention webinar. Please feel free to contact an Orthus Health Coach with any questions or concerns. Thank you for listening.